Good evening, everyone, from Trondheim, Norway. My name is Sven Overland, and I will present a part of my study. Let me just start by sharing screen. So the title you will know from the abstract, I guess. This is part of my PhD dissertation. So the background is fairly known for you all. Between 2 to 4% of all men admit to have accessed or download child sexual exploitation material. Both researchers and law enforcement worldwide report an ongoing further dramatic rise in both production, distribution, and the use of CSEM. We know CSEM is mainly produced by sexual offenders filming their offenses or as part of an organized industry producing CSEM for an interested market, but we know very little about the persons that consume, download, or share CSEM. The consequences of not knowing is, for instance, there are no scientific research demonstrating effect from treatment. Also, some studies show increased rates of reoffenses after treatment. And the reason is probably there are subgroups with different risk and needs, which we do not know much about. So the aim of this study in Trondheim, Norway, it is part of a broader descriptive analysis of persons accepting treatment for the use of CSEM after being charged by the Trøndelag police. The aim of the study is to assess the effect of treatment measured by reconvictions during the first 3 years after end of treatment, and the preliminary results and the first paper focuses on paraphilias as measured by self-report and via visual reaction time when presented with pictures of children, adults, and sexual situations. The treatment, we call it Proteus, consisted of 10 sessions of cognitive behavioral therapy based on individual risk assessment of the participants. The participants were the 12 first persons charged by the Trøndelag Police District for CSEM offenses from August 2020 to January 2021 who agreed to receive treatment. The participants were not convicted or in remand at the time of treatment, but admitted use of CSEM. Participation in treatment did not require participation in the study. The participants were assessed with demographic variables, personality characteristics, symptoms of psychological disorders, therapy satisfaction and feedback to the therapists, assessment of risk for new internet-based and offline offenses, and finally, assessment of sexual preferences, level of sexual activity, and paraphilias. The assessment of the sexuality and paraphilias were based on clinical structured interview of participant in a Proteus. This is with a special developed interview, we call it KIAP, the more known compulsive sexual behavior inventory and sexual experience survey. The ABLE screening for sexual interest, which I will have a quick note about soon, and the ICD-11 and DCM-5 diagnostic criteria for paraphilias, which are a bit different from the ICD-10. So here you can see some information about the ABLE screening for sexual interest. It is a computer-based instrument assessing sexual interest using visual reaction time. So the participants will be presented with pictures of persons in different ages and situation, and you will then get the profile based upon the visual reaction time as measured. There are quite a lot of ethical consideration being done both in therapy and in this study. Persons invited to participate in treatment and study were told that accepting or declining would have no consequences for the judicial process. They were arrested by the police or had the police come over to their house having a so-called knock and talk. Participation in treatment did not require participation in the study, and the study has been approved for the Regional Ethical Committee. Also, a participant from the pilot phase of treatment was part of the advisory panel for the project, and special considerations were taken when participants admitted pedophilia during treatment, especially in terms of risk of suicide. This is a preliminary study, and the result as by now, there was no dropout of treatment. The mean age of participants were 28 years old. That's quite young. And the mean admitted time for the use of child sexual exploitation material, 10 years. 10 of 12 participants had partners or girlfriends. 5 of those participants involved their partners in treatment. The Proteus program advised the participants to bring partners into the treatment. And 3 of the total 12 participants had children. Then we move to self-reported paraphilia and hypersexuality. 1 participant admitted pedophilia at the start of treatment, but 7 more at the end of treatment. In total, 8 participants. 2 participants admitted sexual sadism, which is a diagnosis by the ICD-11. At the start of treatment, this did not change at the end of treatment. 4 participants admitted hypersexuality/porn addiction at the start of treatment, but none at the end of treatment. 1 participant admitted comorbid voyeuristic disorder in the start of treatment, 4 more at the end of treatment, in total 5 participants. And no participants admitted other sexual interest in the start of treatment, but several admitted fetishes at the end of the treatment. So this is a visual presentation. As you can see, there were quite some changes at the beginning and at the end of treatment for both pedophilic disorder, sexual sadism, and hypersexuality. Results from the scoring with the Abel screening of sexual interest. All participants participated in the assessment with the ASE. 10 participants had a score indicating sexual interest for children. 11 participants had a score indicating sexual interest for adult females. 2 participants had scores indicating sexual interest for adult males. And voyeurism and fetishism was the most common sexual interest. So this is the visual graphic presentation. You can see this is from the profiles of the ASI. You can see the female adult and female 13 to 17 year being the highest one. And also female 5 or less, male 5 or less, you will find to the left and to the right from those. And you, on the right side, will find exhibition, voyeurism, frottage, SM, and other fetishism. presented. So from the discussion, I will highlight that the results should suggest a high comorbidity between pedophilia and other paraphilias / sexual interests. The results suggest pedophilia most often is non-exclusive. It is of clinical relevance and interesting that more participants admit pedophilia at the end of the treatment rather than in the beginning of treatment. It is of clinical relevance that participants with sexual sadism seems readily to open admit it. The results further suggest that assessment of both self-report measures and more objective measures as the ASI are beneficial for the therapeutic process. So the take-home message being, most participants in the study of persons in treatment for the use of sexual exploitation materials admitted pedophilic disorders. Most participants have sexual interest both for children and adults. And more participants admitted pedophilia and other sexual interest in the end of treatment rather than in the beginning of the treatment. And in the uploaded material, you will find the paraphilias as by the ICD-11. And you will also find on the left here the Proteus map, which shows both non-sexual and sexual risk factors as prioritized and worked with in therapy. Thank you.